Well, hello, guys. I'm your health education specialist, and I'm here to talk to you today about bulimia. Bulimia, or technically now bulimia nervosa, is a binge eating disorder. It is associated with binge eating and then using compensatory methods to get rid of all the food. Hello, I'm here as your health education specialist. I'm here today to talk to you about bulimia. Bulimia is an eating disorder. It is characterized with binge eating, which are uncontrollable sessions of overeating, which are followed by inappropriate compensatory methods to expel such food. These include vomiting, excessive exercise, inappropriate use of laxatives, and other ways to expel food. One question we get regularly is what are the signs and how do we diagnose bulimia? According to the DSM-5, characteristics of bulimia are excessive episodes of binge eating, recurrent inappropriate compensatory behavior to prevent weight gain, and the symptoms must continue for at least once a week for 3 months. And then there needs to be an undue influence of weight and shape on the self-evaluation of your client. Since most of these are going to be private, I'm going to tell you some warning signs you should look for in people with bulimia. Well, because they are throwing up and vomiting all the time, you want to look for tooth decay, signs of acid reflux disease, sore throat, sore glands in the neck and the jaw area, also a sign of bulimia. And you also want to look for electrolyte imbalance and severe hydration from purging fluids. These are some of the risk factors of bulimia. Being a woman are way more likely to have bulimia than men. So being just a woman in general is a risk factor. You're going to be in your teens, early 20s, a big risk factor here. That's usually when bulimia develops. If you're overweight as a child, as a teen, there's a higher chance of bulimia. And then you want to look for psychological and emotional problems and low self-esteem. We're seeing a lot of people with bulimia with all those characteristics. And a lot of the things the media and society does pressures people into these type of behaviors because there's almost an obsession with being skinny or maintaining one's weight that we're seeing. And then sometimes in sports too. See, this is when men are affected during sports and modeling and acting, just like women are. They have a goal to maintain weight, especially in sports like wrestling. The size of your size is very important to make weight. So you see a lot of athletes like wrestlers with bulimia too. Some of the stereotypes that people often have of bulimia is that it's a lifestyle, it's easy to quit, it's throwing out food, so it's easy to quit, which is not true. These are deep psychologically rooted disorders and almost compulsions that people have, not just a lifestyle. There's another myth that bulimia just affects rich white women. This is not true at all. A lot of people thought that African Americans really wouldn't have this much eating disorders because they have a different cultural idea of beauty that doesn't necessarily do with thinness. But we're seeing rising rates of African Americans, women with bulimia too. Maybe because the standards of beauty have changed a little bit more than initially thought, and maybe they're going along with these. And as a whole, another trigger of bulimia is stress, and women of color have a lot of stress to deal with in their lives due to being female, and a person of color in the society is very stressful. So they are at a big risk factor of having bulimia. Some of the treatments for bulimia are cognitive behavior therapy. What therapists do is they try to change how the people think and their behaviors dealing with food and then their compensatory behavior. So if they want to keep a diary of what they're eating and what's forcing them and what emotions they have when they decide to eat this much, and just come up with better ways to deal with it. And then there's straight cognitive therapy where the therapists try to change the maladaptive behavior and thought processes of the clients by changing their behaviors toward food and the size of their body. Just try to have them gain some more self-esteem about themselves. Antidepressants are also a very effective treatment option for bulimia. One thing I personally did not know about bulimia is it's not just people throwing up. It's other ways that people use to get rid of the food. I did not know that excessive exercising can count, or misuse of laxatives was used. So someone might have bulimia and think just because they're not throwing up that they don't have it. I think it's important for us to remember that bulimia is not just a lifestyle decision. A lot of people think that it's easy for people to quit. All they have to stop doing is eating so much and then expelling that food. Like, it's just so easy. These are compulsive actions that these people have through their cognitive thinking. What they really need is treatment. Our goal here is to end the stigma of bulimia just being some lifestyle choice. It's really not. I don't think anyone really wants to live that way. Bulimia is very dangerous. Eating disorders are very dangerous. The people at higher rates of suicide and depression. So it's a very serious illness that should be treated with respect. So that concludes our lesson on bulimia today.